Hey, Dr. Alan Christianson here. I want to talk about ways to manage sugar cravings to help really beat and defeat those things. It's a big deal. I think that there's a sense people often are given that they're an issue of willpower or, a sign of like weak fortitude, weak morality almost. You've got to just push yourself through these things and not let that get to you and fight those cravings off. And the big picture is I don't think that's effective. When they come, when they happen, they're not psychological, they're physiological. They're not your thoughts that start it. You may experience it in your thoughts. You may be walking along and think, boy, I could sure go for some jelly beans or a Snickers or whatever it is that happens when that switch is flipped for you. But it didn't come about from thoughts. It came about from your body's blood sugar control. It dropped rapidly or it got to a low level and your brain says, hey, I need glucose now to function. And so you respond in a way to satisfy that. So the concept is not so much you've got to push harder, it's that you've got to strategize differently so you can preempt that scenario in the future. So let's talk a bit about just why you want to get away from these cravings. Well, sugar is bad. Pretty straightforward. It's now been implicated to be a culprit for heart disease. Poorly regulated blood sugar has been implicated with every chronic disease you could think of. Brain aging, many cancers, I mentioned heart disease, diabetes, bone thinning, kidney damage, liver damage. So harsh stuff. Sugar's also been shown to be a large agent for body weight, especially sugar-sweetened beverages. Liquids, this is good old water, but liquids just don't fill you up. If you're drinking 10 ounces of water or 10 ounces of soda, you don't feel that much different as far as having eaten something. But whereas that 10 ounces of soda might have been, 100 or more calories, had you just eaten a large orange, you're like, oh wow, I had some food. So big distinction there on that. Another thing you don't think about as much is that sugar can compromise the immune system. Data has shown that processed white table sugar, even a teaspoon, can zap your immunity for up to 6 hours. So good stuff to stay away from. And if that's not enough, then we think about cross-linking of collagen. So skin aging, collagen loss. Sugar speeds that up. It's kind of like smoking as far as the effects upon your skin, smoking or alcohol for speeding up aging of your skin. So other thoughts, we want to be aware of hidden sources of sugar. Sugar often makes you want sugar, ironically enough. And I've had many people to where they've wanted to get rid of it, they've had a hard time doing so, and it turns out they were actually eating a lot of it they were not aware of. So really scour your labels. Be aware that there's a lot of names for sugar. There's actually a list I've made about 257 different common names for sugar. So know a lot of them. The best strategy though is that rather than stressing about some odd chemical, if it's good or bad, just don't eat it. If the food has a long list of random strange chemicals, yeah, don't bother busting out the dictionary. Just put the stuff back. That's not really food for you anymore. I also want to talk about how the adrenals are relevant with this. So the adrenal glands, they make cortisol, and cortisol pulls up your blood sugar. So when your blood sugar drops, you get a burst of cortisol. And you need some sometimes, but too much at the wrong times, and it's just like being stressed. It's no different as far as how it feels on the inside. So that's a drawback about it. So how to quit eating sugar? Well, the first one is to stop eating sugar. Kind of a paradox, right? But no, it's true. I've experienced this personally, and I've had many patients tell me this as well. If you get to a certain point where sugar is just not in your life, it's not a big deal. You really don't miss it all that much. Your taste buds physically change. One of my dear friends, JJ Virgin, did a show called Freaky Eaters, and there was a woman who lived on sugar. I'm not being metaphorical, I mean sugar, like white powdered sugar by the spoon was where she derived pretty much all of her calories. And JJ gave her a bite of mango, and this woman, oh, it tasted so bitter to her. It's like the sweetest fruit she could find. It was bitter to her because her taste buds were so numb from the sugar. After a week of being off of the sugar, she revisited that mango and like, oh wow, this is actually really good. It's sweet tasting. So your taste buds change fast. And once they change in ways that are good, You like healthy, natural, simple foods. They're satisfying, and sweet things are repulsive. They're like sickly sweet. But when you're in the cycle of having them, that's what you're drawn towards. So paradoxically, a way to stop sugar is to stop sugar. And think about it like a drug. It really is. Data shown it can act in the brain like other addictive drugs can. So go completely cold turkey for at least a solid week. And not that you're good after a week, but just know that after some period of time, it gets a whole lot easier. But to get to that point, it takes some days of just full-on avoidance of it. Big tip number 2 is eating breakfast. So not having breakfast, your body is expecting to be in starvation storage mode all throughout the day. And that's going to leave it to where your blood sugar is really ready to drop off. And when it does, your brain's going to send that alarm saying, feed me now, I need sugar. Tip 3, get some protein with each of your meals. So what kind, how much? Think about at least 24 grams and think about complete protein sources. So protein itself makes the food leave your stomach more slowly. That helps it burn more gradually. You won't get the spike and the drop. Proteins also have a big effect with their amino acids on benefiting your brain chemicals. There's also exciting data about how protein is not the same as carbs and fat. When you're getting it, you don't really want as much carb or fat. But if you're not getting it, you want much more carb or fat than you would otherwise. So get your protein, super critical. Tip 4, sleep. Sleep a little longer. If you are having strong food cravings, you may be behind on sleep. You know, an easy way to know if you are or not, go into a dark room and have nothing to do and just sit down or lay down comfortably in the day. Do you conk out pretty quickly? If you do, you're likely sleep deprived. Get caught up. 7 hours is probably a bare minimum for the big bulk of people. Most of us do better with 8 or even a little bit more. Test yourself adding in an extra hour of sleep for a few days. See if your cravings don't go down. When you're behind on your sleep, your brain thinks that it's time to hibernate. Your brain is like getting ready for winter. It thinks the day cycles are changing. And you go into that storage mode. You want more sweet things and more sugar. So sleep is critical for that. Next tip is hydrate. So in many cases, it makes me think about that. In many cases, the signal for thirst and the signal for hunger can feel a lot alike. They can feel very similar. Shoot for at least an ounce of water per pound of your body weight per day. For most of us, that ends up being a gallon or so, maybe a little more, a little less. Definitely do purified water. I'll talk more about this elsewhere. Lead is a huge concern in municipal water. It's not just Flint, Michigan, it's throughout the country. There's probably 30% of us that are exposed to unsafe levels of lead in the water. So you've got to have purified water and you need a lot of it. Step 6, do not fall behind on magnesium. It's super, super critical mineral for so many facets of blood sugar metabolism. And the data is strong that we don't get enough of it even on healthy diets. We use NPK, nitrogen, phosphorus, potassium, to fertilize foods. That combination strips magnesium from the soil. My very favorite, there's 2 types I love a lot. There's dimagnesium malate, and there's also a version that's magnesium threonate. And those are the ones that do the really good job at absorbing effectively, but also crossing the blood-brain barrier. And that's a trick for reducing sugar cravings, is getting into the brain where you need it. So tip 7, to not crave sugar, eat some good carbs. So simple thing, but if you're lacking in good carbs, your body is going to have more blood sugar instabilities. The old idea was that if you don't consume carbs, your glucose is steady. But your body has to have glucose. So if you're not eating carbs, you will make glucose. A lot of us don't do a good job at that. We tend to make it pretty erratically, and that can create more problems with our blood sugar than stable, slowly absorbed versions of glucose can. Think about carbs over 30, 55% of calories. High end if you're very active and you're one that does better on lower fat. Low end for the opposite. But I would not go less than that. You can get away with fewer carbs in the morning meals, but you do want some in the evening meals. Your best ones are those that have resistant starch, come from legumes, intact ancient whole grains, and then vegetable starches. So tip 8 for helping to dial in your blood sugar. Reset the neurotransmitters. You know, you're really utilizing serotonin, dopamine, GABA as critical parts of the mood. And when they're not right, they drive your body to have more erratic cravings for carbohydrate. There's actually a big cycle between how tryptophan forms serotonin in the brain and how your body craves sweet things. So having good protein to have tryptophan, and then if need be, supplementing with HTP or other precursors to form serotonin, you can minimize the cravings. So remember, the sugar is critical. Your blood sugar regulation is all about so many facets of health and longevity. The adrenals are the big glands that manage that. If you're not sure how yours are these days, try out the adrenal quiz and see how they're functioning. Dr. Alan Christianson here. Take great care of yourself, and we'll talk really soon.